All right, everyone. Well, thank you. And thank you for your patience while we work on some technical aspects of our ECHO today. I want to welcome you to the Alaska Public Health Science ECHO. My name is Erin. My pronouns are they, them, and I'm with Project ECHO. So during this session is where the public has the opportunity to ask science-based questions for our public health team. For those of us joining on Zoom, questions may be entered into the Q&A feature. For those of us joining on Facebook, please add your questions in the comment section and they will be shared with our panelists. As a reminder, we expect all participants to keep questions and comments on topic, to be considerate, and to use language that is respectful. So thank you for that in advance. If your internet connection does not support audio, you may join us by phone by calling the phone number we've entered in the comment box along with the meeting ID. Closed captioning is also available as well. The closed captioning button is on the bottom of your Zoom screen. Thank you to our captioner. I'd also like to note the opinions expressed in this session are those of the speakers and do not necessarily represent those of UAA, DHSS, or any ECHO sponsors. Now we'll go ahead and proceed to introduce some of our State of Alaska Hub team, starting with Dr. McLaughlin, please.
Hi, everyone. This is Dr. Joe McLaughlin. I'm the chief of the Alaska section of epidemiology and the state epidemiologist.
Thank you so much. And Anna, if you could introduce yourself.
Hey, I'm Anna. I do syndromic surveillance and infection control here at the state section of EPI.
Excellent. Lisa, please.
Hi, I'm Lisa with the State Virology Lab, sitting in for Dr. Parker.
Thank you, Lisa. And Clinton.
Hello, everybody. Clinton Bennett, Communications Director, Alaska Department of Health and Social Services. Good afternoon.
And Heidi, please.
Hi, everyone. Thanks for joining us. My name is Heidi Hedberg. I'm the Director of Public Health.
Elizabeth, if you would.
Sure. Good afternoon, everyone. I'm Elizabeth Manning, Communications Manager, DHSS.
All right, and Dr. Rabinowitz.
Hello, Lisa Rabinowitz, Staff Physician with Public Health.
Dr. Cutchins.
Hey, Coleman Cutchins, Clinical Pharmacist here with Public Health in the State COVID Testing Week.
All right, thank you. And Dr. Castrodale.
Hi, I'm Louisa Castrodale. I manage the infectious disease program here at the section of EPI. Thanks.
Thank you. And Dr. Demain.
Yeah, hi, I'm Jeff Demain. I'm an allergist immunologist here in Anchorage, and happy to be here and happy you've joined us.
Thank you so much. And Barb.
Hi, I'm Barbara Pennington. I'm a state school nurse consultant. I work in public health.
Excellent. Well, without further ado, we'll go ahead and proceed with our slides. I'll go ahead and pull those up.
Great. Thank you, Erin.
All right, I take it that that's not visible yet.
It's not, so why don't we?
Okay, all right, one sec.
Oh, good, there we go. Okay.
Excellent, thanks.
Excellent, all right, well, thanks so much, everyone. Sorry for the technical difficulties here at the beginning, but let's go ahead and dig into the slides. So next slide, please. So first, we're going to start out with some general safety and prevention tips. Okay, next slide, please. All right, so this is just a slide showing a number of the hazards that we all face in the summer months. Alaska's cold water can be lethal. Definitely make sure you're wearing your life jacket if you're in Alaska waters. Even strong swimmers do drown long before they become hypothermic. So please wear your life jacket. And if you're going to be in cold water, you know, maybe it's a good idea to have a wetsuit on or even a dry suit. So consider those things. Alcohol use is the leading contributing factor to fatal boating accidents, so please do not boat and drink. Next, in the lower left there, I see some shellfish. We do have paralytic shellfish poisoning here in Alaska. And so people should be aware of that. There are a number of different species of shellfish that tend to accumulate the toxin that causes paralytic shellfish poisoning. Typically, people who get PSP will start developing numbness and tingling around their mouth, their tongue, sometimes in their fingers and their toes. And then that the paralysis can basically kind of come inwards from the mouth, from the fingers, from the toes, and then make its way in towards the muscles of respiration. And certainly that is the thing that is most worrisome about paralytic shellfish poisoning, is if it causes paralysis of the muscles of respiration. That means that people can't breathe. Typically, the onset is short, within minutes to a half hour or so after consumption. Helmets in the center there at the bottom are very important. Please make sure you've got good modern helmets. Some people have really old helmets, 20, 30-year-old helmets that they're still relying on. I strongly recommend getting a newer helmet. The technology has improved quite a bit, and you can find some newer helmets that are inexpensive and really help to protect your head if you were to have a biking injury or some other sort of injury. And then ATVs there, during the summer months, we do see a lot of accident-related injuries. And in fact, those accident-related injuries can contribute to increased hospitalization rates in Alaska in the summer. So again, if you are using ATVs, please drive safely. Do not use alcohol before driving them. And of course, always wear your helmet. Okay, next slide, please. All right, so this is the Alaska Hospital Data Dashboard. Again, as I mentioned, during the summer months, oftentimes we do see an increase in hospitalization due to traumatic injuries, people being out and about on four-wheelers and bikes and different things and getting injured. So it can be complicated, certainly when we've got a pandemic happening and we start to see COVID-related hospitalizations that can, just exacerbate the problem of hospital capacity in some of Alaska's hospitals. So we want to do whatever we can to minimize the number of people, obviously, who get COVID and then, of course, get sick enough to be hospitalized. The number one way to do that is to get vaccinated against COVID-19. Okay, next slide, please. All right, more on the COVID-19 update. All right, here is a slide that shows two figures. The first figure on the left is the United States daily trends in the number of COVID-19 cases reported to CDC. And then on that left-hand graphic, you'll see the yellow line represents the moving average, 7-day moving average of the number of people who have received at least one dose of a vaccine. And you can see that, you can't see my arrow, but you can see when it peaked there in terms of the number of people. And then we had a precipitous drop off on the number of people who have received at least one dose. And we really want to do whatever we can to encourage people who have not yet been vaccinated to go ahead and get vaccinated. And this is an opportunity for folks to ask questions about the vaccines, the safety, and the effectiveness. On the right-hand side, you've got Alaska's daily incidence case incident chart. And again, on both of these graphics, we see a pretty precipitous uptick in cases in the last month or so. Okay, next slide, please. Here's our dashboard, just shy of 70,000 cases total in Alaska, 1,667 hospitalizations, and 374 fatalities. As you can see in the left, we're starting to see more and more of Alaska turn red, unfortunately, and this is primarily due to a couple of factors. Number one, the Delta variant is now the predominant strain in Alaska. And we know that that Delta variant is much more transmissible than other variants. It's felt to be about 50% more transmissible than the Alpha variant, which is the B117 that emerged out of the UK. And remember that Alpha variant is considered to be about 50% more transmissible than the original wild type strain. So this Delta variant is very, very transmissible. Okay, next slide, please. And here you can see that unfortunately the state of Alaska as a whole popped up into the red zone. That happened on July 16th, looks like. Yep, July 16th through 18th, I think. That was the date when we went back into the red zone, unfortunately. Okay, next slide, please. Here is our graphic about our variants that we're sequencing, and this comes from the genomics report that just went out yesterday. The far right-hand column is the most recent data, and remember that the sequencing data has about a 2-week lag, roughly. So what you're seeing is data from the week of June 27th. The Delta variant comprised about 56% of all sequenced viruses. And so the most recent report that I've seen is a much higher percentage. So the Delta variant is definitely the predominant strain, and this mirrors what is happening in the lower 48. Okay, next slide, please. Here we have another slide just showing the different variants. We are still seeing a fair amount of Alpha, but you can see that 56 more cases of Delta variant from the previous report. So that is definitely spreading quickly. Okay, next slide. Okay, this is just a simple reminder of what to do if you do get sick, if you have any signs or symptoms of COVID whatsoever, no matter whether or not you're vaccinated. Please get tested. We want as many people to get tested as possible if they have symptoms. Stay home and isolate if you do test positive. And while you're waiting for that test result to come back, we want you to stay home and isolate. Inform close contacts of your illness. Anybody who is unvaccinated who is a close contact, starting about 48 hours prior to symptom onset, those people will need to quarantine. And remember, a close contact is anybody who's been in within 6 feet of the infected person for at least 15 minutes. I want to encourage folks, of course, to take care of themselves, hydrate and rest. You can take over-the-counter medicines as well to help alleviate symptoms. And then, of course, contact your healthcare provider if you have trouble breathing or you have any other warning signs, or if you think that there's an emergency happening. Certainly better to contact your healthcare provider if you're starting to get worried earlier than later. And avoid public transportation. We do not want people who have signs and symptoms of COVID to be on buses and around others when they're sick. There is a testing site locator map, and the website is there on the bottom on the right. And you can just type in information on where you are physically located to get better information on where those testing sites are. Okay, next slide, please. Here's our percent positivity. Unfortunately, the percent positivity continues to increase. This is as of the 18th of July. Our percent positivity was 4.88. I suspect it's probably around 5 or over now. This is not the direction we want to be going, so we want more people to be getting tested. And certainly anybody who has been exposed to COVID, if they're in quarantine, if they're unvaccinated, we encourage folks to get tested between about days 5 and 7, 5 and 8, something like that. And if you're fully vaccinated and you've got let's say a close contact who's a household member that has been infected, you could get tested too if you want. We're not saying that you need to get tested, but certainly if you're fully vaccinated and you want to know whether or not you've been exposed and you've been in close proximity, like a household type of situation with somebody who's infected, that would be something that you could do. Okay, next slide, please. All right, here's our COVID vaccine dashboard. 56.6% of residents have had at least one dose, and this is residents who are 12 and over, and 51.7% of residents 12 and over who have been fully vaccinated. We haven't seen these numbers change too much over the past several weeks, unfortunately, and we're very hopeful that now with this Delta variant circulating and our case counts really increasing dramatically, that people who have been hesitant to get the vaccine will please come forward and get vaccinated. You can see on the left-hand side the vaccination coverage rates, the heat map. The darker green is the higher vaccination coverage rates, and the lighter green to almost yellow is the lowest vaccination coverage rates. So we really need to do a lot of work in those areas that have low vaccination coverage rates to get those rates up. Okay, next slide, please. Here's the Sleeves Up for Summer events calendar. It's available at that website there at the top of the page, and you can just see what events are happening in different regions of the state. Okay, next slide, please. Back to school. One of the most important or critical strategies to help schools safely resume is achieving high levels of COVID-19 vaccination among eligible students, teachers, staff, and household members. There is guidance that CDC has put out on this, as well as the American Academy of Pediatrics has some guidance for safe schools as well. Next slide, please. And again, vaccine appointments are available. They're easy, free, widespread availability. You can visit covidvax.alaska.gov to get more information, or check out some of the other resources there. Okay, next slide, please. All right, I think that's it for the slides. Let's go ahead and open it up to Q&A.
All right, thank you so much, Dr. McLaughlin. Let's see here. We have a lot of questions today, so we'll try to get through as many as possible, including live answers and then those typed by our hub team in response. So keep an eye out for those. We'll go ahead and start with a topic that seems pretty prevalent here in the chat with Sitka recently. So a question asking if someone from our hub team can speak to the situation in Sitka where infected symptomatic individuals boarded an Alaska Airlines flights. Reports are that they couldn't be prevented from boarding.
Louisa, you want to start with that?
Yeah, sure. And I can speak generally about the what we call the DNB, the do not board process. This is something that's managed federally through the quarantine stations that are the CDC quarantine stations. And so when we have a situation, whether it's COVID or another infectious disease where we're concerned about someone who might be going for some air travel, who might have an infection that's communicable to others, we can connect with the quarantine station and have a conversation with their medical officers to put somebody on a no-fly list or a do not board list. This is a conversation that goes through several aspects. You know, what's the disease, how infectious is this person, and what is their intent to travel, because there needs to be that component of an intent to travel, not just somebody who said, oh, you know what, I just found out I was positive or I'm infectious, I'm gonna stay put. And so we go through that process. It's not a quick process. It does take conversations with those staff from CDC to come to that decision to put somebody on that list. And this, when somebody is on that list, it means that if they go and they try and check in with TSA or with the airline, they will be denied boarding. Just as there's this process to put somebody on the list, there's also a process to take them off the list. So you still have to gather all these folks together to have that conversation about why they're no longer infectious. We've used this. This is not a COVID tool. This is a tool that's been in place, I don't know, probably for decades. We've definitely written some bulletins about the do not board process and work actively with our quarantine station partners when the need arises. And sometimes because of timing, it's difficult to either get somebody on or off that list very quickly. So I think that sort of broadly just sort of explains how that works for us.
Thank you so much, Dr. Castrodale. So building on that, we have another question that asks, based on those current state of affairs in Sitka generally, where they're experiencing a high rate of positive cases, what can you recommend for fully vaccinated individuals? This person is sharing that they know that breakthrough cases are to be expected, but are rare. However, that being said, through word of mouth, there's been concern about several breakthrough cases potentially above the national average rate in fully vaccinated people. Is it possible that one community could be experiencing higher rate of breakthrough cases than others? And if so, why?
Great, yes. So this is sort of a complex issue with respect to just kind of understanding the math. But Coleman, I wonder if you could pull up that graphic that you showed on the Echo yesterday. And maybe while Coleman is pulling that up, I will start with maybe a way of describing what's happening that might make things a little bit more clear to folks. Okay, so let's just take a hypothetical situation where you have two groups of 100 people. So 100 in group A and 100 in group B. In the first group, group A, everyone's fully vaccinated. In the second group, group B, no one is vaccinated. And just to make this simple, let's just say that nobody has had SARS-CoV-2 infection in the past either. So everybody's susceptible. And now let's say you expose everybody in both groups to the SARS-CoV-2 virus. So every single person is exposed to the virus. In group A, you're going to have about 5 to maybe 25 people who get infected, or what we call breakthrough infection. And it'll depend on which vaccine the person got, and it'll also depend on which strain of the virus the people were exposed to. So if you had an mRNA vaccine and you were exposed to the wild type strain, the original Wuhan strain, probably about 5 out of those 100 people will get an infection. If you had maybe the Johnson & Johnson vaccine and you've got the Delta strain that people were exposed to, it's probably going to be closer to about 25 or maybe even a little bit more than that, people who will get infected. That's group A. Group B, everybody is expected to get infected. All 100 people are expected to get infected no matter which variant you expose them to. So now the question is, what of those people who get infected in group A and group B, what proportion are going to get hospitalized and what proportion will die? So it depends on the proportion of people in those groups that are high risk. So let's say that the two groups have the same proportion of higher risk people. And these are people who are elderly and people who have underlying medical conditions. Then the hospitalization and death rates among those who were previously vaccinated will be much, much, much lower than the unvaccinated group. And at this point, about 96% of COVID hospitalizations and about 98% of COVID deaths that have been in Alaska in recent months have been in unvaccinated persons. So hopefully that helps people understand kind of the situation a little bit better. If you're in group B, you haven't been vaccinated and you haven't had prior infection, every single person in that group is expected to get infected. Now, Coleman, can you just kind of present that graphic that I think will be helpful as well?
Yeah, this graphic I think is a good visual. You know, if we take this theoretical group of 100 people with an 85% effective vaccine, you know, as we get the more people vaccinated, it's more likely that our vaccine breakthrough cases are roughly equal to our unvaccinated cases. You know, however, though, when we look at it in terms of like a percentage, you know, with the denominator, you know, this 2 out of, 85 people is about 3% versus, you know, 2 out of 15 is like 23%. So I think that it's important with the denominators, but I also think it helps show us to understand as vaccine rates go up, you know, the total number of vaccine breakthrough cases may seem high, but it's important to remember, what it is as a percentage of the total population, because the people in this vaccinated group had a much lower risk of being one of these two cases versus the people in the unvaccinated group.
That's really helpful, Coleman. Thank you. And I think I recall seeing that Sitka, the vaccination coverage rate was pretty high. I don't have the exact number. Maybe somebody could pull that up. I thought it was over 70% last I heard. So that would mean that the number of people in Sitka who are fully vaccinated is a much larger percentage-wise number than the number of people who are unvaccinated. And so that's why you'll see some disparities that seem a little bit odd. Why are we seeing so many vaccine breakthrough cases? Because there's so many more people who are vaccinated. So hopefully that helps kind of clear things up a little bit for folks.
Yes, it gets 75% one dose and close to 70% fully vaccinated.
Okay, thank you.
All right, thank you so much, Dr. Cutchins and Dr. McLaughlin. Building on that, is it possible for our hub team to clarify that of the 98% of deaths that are related to COVID that are from folks who are unvaccinated, how is vaccination versus not being vaccinated defined? Because I know there is that 2-week wait period. So if some clarity could be provided around that, that would be helpful.
Sure, yeah, fully vaccinated means that if you had an mRNA vaccine, it's 2 weeks after you got your second dose. And if you had the Johnson & Johnson vaccine, it's 2 weeks after you got your first and only dose in the series.
So I guess with that being said, is anyone who doesn't meet that category is considered unvaccinated?
Or not fully vaccinated.
Or not fully vaccinated. But when we talk about vaccine breakthrough, it's specifically people who are 2 weeks out from their second dose or 2 weeks out from their Johnson & Johnson. And then everybody else is anyone who doesn't meet that criteria.
All right, thank you so much for that clarification. We also have a question building off of the situation in Sitka, asking about that Alaska Airlines flight, and maybe more generally also about contact procedures after exposure in a public environment like that. So specifically, on that commercial flight, has public health reached out to passengers and others that were potentially exposed? And if someone could speak to that process, it would be appreciated.
Sure, I can talk a little bit about how that happens. And again, this is what happens for COVID or any other infectious disease. We get notifications about measles or TB exposures that might have happened on an airplane. And so in addition to, there are a lot of people who fly in on an airplane and get tested at the airport, and they're a positive person who might have been on an airplane or they've been flying later on. And those notifications, again, go back through to the quarantine station, who then works with the airline companies to go through the passenger manifests and then shoots out notifications to the states where they have residents who have been exposed. And so then the states loop back with those individuals to let them know, hey, you were on this flight, you might have been exposed to measles, maybe you should check your vaccination record, or you might have had another exposure. And so that process is just ongoing for any infectious disease that is tracked by the quarantine station. And so we could anticipate that, and actually it has been since COVID started way back last year, that there have been notifications that go out daily to residents of those states who were sitting next to a person who had COVID or another illness.
Thank you so much, Dr. Castrodale. Let's see here. So we have quite a few questions related to school and the upcoming school session. So we'll start with a few of those and try to group them together as much as possible. Again, we do have a lot of questions here and only half an hour left, so we'll do our best. A question here asking, what are the risks of kids going to school or preschool where masks aren't required? If this person needed to send their children, they would send them with masks, but if the Delta variant is too risky, I would consider homeschooling until vaccinated.
Great. Coleman, do you want to start with that one, or Barb?
So I guess I can start with it. So the CDC did just put out new guidance for schools and also new guidance for daycares. In there, the underlying theme is that, vaccine is our best prevention strategy. However, what is really nice about these guidance is they do add for some flexibility and stress the importance of getting kids back to in-person school. So I encourage everyone to read them. I'll put them in chat, but really it comes down to these strategies. So, and it's not a all or nothing, and it's not a one size fits all model. So really it encourages schools to look at promoting vaccination, consistent and correct mask use, specifically around people who are unvaccinated, but also there are some reasons why people could consider universal masking. Physical distancing, screening, testing, ventilation, hand washing, staying home when getting sick, contact tracing and cleaning and disinfecting. So really it's a combination of all of this, not a kind of pick one and do it. And it really adds for flexibility of the community, the school, current infection rates, and a lot of variables, and they're well done guidelines. I encourage people to look through those. Barbara, would you have anything to add to that?
I would just say that there's been several questions in the chat, regarding parents and what you can do. And I would say that you have a voice, and read the literature, read the science, and speak to your school boards. We have, as a team, been promoting with our public health nurses, vaccine clinics all over the state and for the teens. And we will continue to do that once the vaccine is released for the under 12-year-olds. So there are plans in place for school vaccinations. Some communities, as you know, each school district is local control. So the public health nurses are working with every school district around the state to make sure that there are plans in place. And some are working with their local clinics, and some are working with local providers to help to provide that. But basically, we are giving information to the superintendents also. We had a meeting this week with superintendents and school boards to give them the current information, both from CDC, the updates, and the American Academy of Pediatrics, and they have had a chance to ask questions. So there are conversations going on around the state to look at these new updates and what is the safest way to bring kids back to school.
Thank you so much, Barb. Building on that, could you perhaps speak to the process for in-school vaccination with parental permission? We had some questions regarding that process.
So each district there are parental permission forms that we have from a state, for the state right now, that some districts have been using. Absolutely, parents have to give permission. Some of them are using, like I said, local providers to give vaccines in the school settings, some on Saturdays, but there's no permission sheets yet for the under 12-year-olds. But like I said, there's a variety of permission forms out there depending on who's giving the vaccines.
Thank you so much. And some additional questions in relationship to school response and vaccination. We have a question asking if schools get updated often with the most current information about COVID and procedures around that.
So we have a school health echo that we've had twice a week over the summer, and we're starting again every Monday at 3 p.m. that we invite our school staff to. We have many school nurses, superintendents come on that, and we have been updating superintendents also. So most of this team is on that school health echo, and we'll have another one Monday. So yes, we are updating the school staff.
Thank you so much, Barb. All right, let's see. We have some questions about the increased risk with the Delta variant. And I know we touched on this a little bit earlier, but perhaps we can circle back around since it seems to be a common question. In particular, can we talk about the risk for infection with the Delta variant and the latest science about how that infection might impact folks, in particular children?
Sure, I can start with that. So as we discussed earlier, the Delta variant appears to be about 50% more transmissible than the Alpha strain, that B117 strain. And for comparison, that B117 strain was is felt to have been about 50% more transmissible than the original wild type strain. So the Delta variant is very transmissible. It appears to be the most transmissible variant of SARS-CoV-2 virus that we've seen yet in this pandemic. And so that basically means, you know, there are a number of research studies that are really looking into why it's more transmissible. It appears as though it does bind a little bit more tightly to the receptor sites on cells, but there may be other factors at play as well. So basically, if you get infected with the Delta virus variant, then you know, the next step is whether or not you're actually going to develop COVID disease. And we know that historically with this pandemic, probably about a third of people have been asymptomatic. I haven't seen any recent epidemiologic studies focusing on the Delta variant and what proportion of people who are infected with that variant actually are asymptomatic. I suspect it'll be similar. There was a study that was published out of Scotland about 3 or 4 weeks ago, indicating that the hospitalization rate among people who were infected with the Delta variant was about 85% higher than the hospitalization rate among people who were infected with the Alpha variant, that B117 variant. I haven't seen other studies on this yet, so it's not clear whether or not the Delta variant is associated with higher virulence or ability to cause more severe disease. There's just that one study that I'm aware of. So please stay tuned to, you know, we'll provide that information as more information becomes available. Louisa, anything else, or Dr. Demain, that you would add?
Well, I think I agree with you, Joe.
Great.
A succinct concurrence, excellent. Just building on that a little bit, in terms of mechanisms of transmissibility, we have some questions asking about the Delta variant perhaps being something that can linger in closed spaces a little bit longer. Can we touch on that before we move on to some other questions here?
Sure. Anna, would you like to take a stab at that one?
I'm sorry, I was typing an answer to a question. What was this one?
Yeah, so this is more about the transmissibility and the chance that the Delta variant could linger in closed spaces, quote unquote, for a longer period of time. The questioner asked if that's something that's true, and basically, you know, what are the increased risks for that with Delta variant?
Sure. So, and I see if there are a few questions that are asking, what does it mean when we say that a variant is more transmissible than another? So when we think about transmission of a disease that's spread by, when we think about transmission of a disease, there are sort of a couple components of things that have to happen in order for that affect how likely you are to get an infection following an exposure. So one of them is the infectious dose, which is how many of the germ you need to get inside you in order for you to get sick. One of them is, and so I guess what really drives the infectious dose so that's like a number you need to get in order to reach that number. You have to get enough of it, which if it's a foodborne thing, that might mean you need to eat enough of the food or drink enough of the water, or in the case of COVID, you have to breathe in enough of the droplets. And so there are a lot of factors in the person who has COVID who is breathing it out that might affect how likely you are to breathe in enough COVID to get sick. And that might include how much virus they are shedding, how big the droplets are that they are shedding, how much air volume is in the room that you are in with that person. So like if the room is very small and they're breathing out a lot of virus, you will breathe in more virus every time you inhale. And so that increases the likelihood. Similarly, there could be things that change the infectious dose that are characteristics of the virus itself. So that's stuff like Joe mentioned that the spike protein on the outside of it, how well does it bind to your cells? And how good is it at hiding from your immune system if it does bind to and get inside your cells? And some of the changes that we've identified in the variants do affect that part of it as well. I don't think I've seen any studies that really talk about if we have a good handle on if the infectious dose has changed, nor have I seen a lot of data that really clarifies whether they think the problem is related to, or whether they think that the higher transmission rates are related to greater viral loads or anything like that, or increased transmission. So I guess the data that we have now says that is sort of the math that says when people are exposed to Delta, more of them get sick. So we know the end result, but we haven't figured out the mechanism yet. But those are things that hopefully we will learn soon, because that is lab work that we know how to do now, or we've known how to do.
And this is Joe. Thank you, Anna. I'll just add to that and say that there have been some studies that have been done suggesting that the viral load among people who are infected with the Delta variant gets higher quicker. And so it could be that people who are in the pre-symptomatic period may be more likely to transmit the virus to others because they've got a higher viral load quicker during the infectious process.
All right, thank you so much, team. Let's see here. So a question relating to quarantine time and post-vaccination. So for folks who have been vaccinated and yet test positive, what is the quarantine guidance? And the questioner expressed some confusion about like testing time. So specifically, should they be waiting 4 to 5 days to get tested with a quote unquote better result? So two-part question, both for testing for COVID when you've been vaccinated, and then quarantine times should you test positive.
Sure, I can start with that, and maybe Louisa will have something to add. So first of all, if you do test positive, then it's isolation. You go into isolation, not quarantine. So remember, quarantine is for people who are exposed to somebody who was infected but haven't yet developed any symptoms. So if you test positive, you go into isolation. And that isolation period is typically 10 days, whether or not you're vaccinated. Now, if you're asymptomatic, you have no symptoms, you can test out of isolation earlier as long as you get 2 negative molecular tests at least 24 hours apart. That's only for asymptomatic people. But for symptomatic people, you need to stay in isolation for a full 10 days. Louisa, anything you would ask or add?
Yeah, I mean, one thing I just would want to mention is, we know that people can shed COVID-19 virus for a while. And this option to potentially reduce your isolation is just that. It's just one option. And I would say, honestly, and it's only for asymptomatic people. And people just need to know that it's possible that you could get 2 negative tests 24 hours apart and reduce your isolation. It's also possible you could just keep testing positive. And this is why it's not sort of why it's just kind of a standard recommendation for everybody who tests positive, is that you can really shed for a while. And so it's just those people who have, quite a small amount of virus that can, kind of get those 2 negatives and get and reduce their isolation by that. So I guess while it is an option, I guess I wouldn't want people to think that it's sort of a guaranteed thing, because you could just as easily test positive and sort of need to do your 10 days from that, for sure.
So I'll add, because we've had a lot of confusion over this. If you look at the performance of the molecular tests, these are the diagnostic tests that look for the genetic material. The positive is a whole lot more likely true. So if someone tests positive one day and negative the next day, statistically speaking, it's way more likely the positive is real and the negative is false than the false be real and the positive be false. If you look at it, 98, 99, 97, 98, 99% sure that positive is true, but a lot of these tests, you can only be like 75, 80, 83% sure that that negative is true. So just really want to put that into perspective that, the positives are very, very high likelihood that you do have that it is detecting the virus.
And Aaron, maybe before we go on to the next question, I just want to show folks what is happening in other countries right now. Here, can you see this graphic, Aaron? Yep, okay.
Yes.
So here you have what's happening in the United States. So we can see this pretty marked uptick in cases over the past several weeks. And our neighbors, Mexico to the south, they're also experiencing an uptick. Canada, nothing yet, fortunately. But this is what's happening in the US. Let's take a look at the United Kingdom. That's the Delta variant. That's what's happened in the UK. And that's over the past month. Same thing with the Netherlands. This is primarily the Delta variant. In Spain, we tend to be about 3 weeks behind Europe in general, or we have tended to be about 3 weeks behind Europe throughout the course of this pandemic. It's not always the case, but that's kind of been the general rule of thumb. If we see what's happening in Europe, we can expect that something similar could happen in the US in the weeks ahead. So we want to avoid a graph that looks like this, or this, or this. And that's why it's absolutely critical that we get people vaccinated now, especially as fall is just around the corner, kids are going back to school, all that. We just want to avoid these very steep, precipitous increases in COVID cases. So hopefully that graphic is helpful for folks.
Here's another graphic this morning that was presented on one of the national treatment calls. And this is nationally here in the US. So if we look at this orange square, this is Delta. And if you look at the, very large increase in Delta when we go back to early June, this block is just essentially doubling in size on a weekly basis. And there's always about a 2-week lag. It was 83% yesterday, it's 85% today of our cases identified in the US are estimated to be Delta. And there's places in the Midwest where it's pushing at over 95%.
Great, thank you, Coleman. And Lisa Smith, I wonder if you could even speak to some of the more recent sequencing data, even more recent than the genomics report that just went out yesterday.
Yeah, so the sequencing batches that finished up this week, which wouldn't have been included in the report that went out yesterday, were by and large Delta. It was the first time I've seen a sequencing batch where over 85% of everything sequenced was one lineage. And in this case, it was the Delta variant.
So that's the message that we need to send across Alaska so people know this Delta variant is now what is circulating widely. And as Lisa said, the most recent batch was, over 80%, over 85% Delta. And so, we just need to act now to prevent a dramatic increase in cases like as the United Kingdom, Netherlands, and Spain have experienced. The ways to do this: number one, get vaccinated. Please get vaccinated. Number two, all of the non-pharmaceutical interventions that we've been employing throughout this pandemic are still very useful against this Delta variant. So masking, social distancing, avoiding crowds. Certainly anybody who's unvaccinated, we strongly recommend that you follow all of those precautions. And then for folks who are fully vaccinated, who want added protection, because we know these vaccines, while they're amazing, they're not perfect, and there are breakthrough cases that occur. For folks who want added protection if they're fully vaccinated, please consider wearing a mask and social distancing and stay away from crowds.
All right, thank you so much. So we are nearing the end of our session here, and I know that we have a lot of questions related to the upcoming school year and masking and guidelines. And I know, Dr. Cutchins, you touched briefly on the CDC recommendations. I know that recently in the School Health Echo, we went over this quite a bit in terms of their recommended guidelines. Is that something perhaps that we could speak to for a minute? And I'm also happy to refer people to our next session for the School Health Echo on Monday.
You know, Erin, I wonder if maybe it'd be good to put the recording, because the School Echo that we did the week before last on the CDC guidance was recorded and we went over it in detail. The other thing I'll mention is for kids under 12, so we do know that Pfizer has met enrollment in their trials for kids ages 5 through 11. That's really good news because now we get an actual timeline. Before they met enrollment, it was sort of always 4 months out and it was a moving 4 months out. Now, what we really think is it's closer to a real 4 months out. So my guess now is that we're looking probably November-ish, could be sooner, could be later. And the closer we get to that, the better idea we're gonna get of the actual timing for kids 5 to 11. The trials in kids under 5, 6 months and up are still underway, but that's where we are for vaccine in the younger kids.
All right, thank you so much, Dr. Cutchins. And for you folks, that was a great suggestion to include the link from the last School Health session. So I'll make sure that that's posted on our Facebook page for folks to access. In addition to that session, we have a variety of public health echoes that are free for public viewing. So I know that a lot of the questions that we're getting here are answered in some of those. All right, moving on to our last few questions. We have some curiosity about the dashboard that folks can access, and specifically about hospitalizations, and if that, are there more hospitalizations now, or have there always been this many? And if the dashboard default includes only general acute care and critical access facilities. Do we have somebody who could speak to that?
Anna or Louisa, one of you want to take that?
Not exactly, because I think they're talking about the hospital dashboard and not the cases dashboard. So I would have to defer to somebody else for that. But I will mention that since Joe did the slides, the dashboard has been updated. And so you can see the numbers from yesterday and today. And in case you haven't seen those, we had 2 days that were over 200 cases. So I think, you've been hearing how things are turning red throughout the state. And just if you haven't checked out the dashboard recently, you can get those updates now. But I don't, Heidi, do you know more about the hospitalization dashboard or more of the capacity dashboard?
Yeah, thanks, Louisa. I mean, I don't think I'll be able to answer the specific question, except I would like to highlight for everyone, if you go to the hospital dashboard and if you look on the upper right-hand corner, there's a pull-down menu where you can select a general acute care, yes or no, and you can also sort it by region. Just as a reminder, when we receive feedback on our dashboard, we're always trying to figure out, like, how can we put some of that feedback in so the information is always being updated as we display that information. So it doesn't answer the specific question, but just for awareness on toggling between yes and no on general and acute care. I would say, the reflection of the hospital dashboard is the hospital is providing that information. It is delayed information. It is not just COVID. There's also, in the summer, people are active. That's why we started with being safe, because we are starting to see more trauma cases, more just general injuries, because people are out and about and being active, which is a good thing. So a general reminder on safety, as we look at healthcare capacity as a whole, specifically in Anchorage, we are seeing that things are getting a little bit tighter, but it's not just because of COVID, it's the totality of everything that the hospitals are seeing in their emergency department. We are also seeing that a lot of individuals are catching up on their preventative care, on their elective surgeries. And so I think that's also an added component to what we're seeing overall with hospital capacity.
All right, thank you so much, Heidi. And we'll go ahead and take this last question, which is a general question about the about boosters, if those will become available, and what potential recommendations are for boosters down the line.
Great. Lisa, would you like to take that one?
Sure. So great question. Boosters is always a hot topic, and there's been a lot in the media over the last couple of weeks. So we kind of talk about this a lot, but there's kind of two reasons we would need a second dose or booster dose. One is if we start to see immunity really waning, and the other is to combat a variant of concern that's really taking hold. Currently, the vaccines that we do have are working pretty well against this Delta variant, and especially after your second dose of the mRNA vaccines, we're seeing great efficacy. So encouraging people to finish their whole series. With regards to boosters, Pfizer has given their data to the FDA. There's actually a meeting tomorrow where the ACIP is going to look through some of that data and look through some of the recent studies that are being done, and also evaluating breakthrough cases to make some decisions. One of their concerns is in immunosuppressed individuals. How are these vaccines working? Are those individuals that could benefit from another booster dose? And so that's kind of the discussion that may happen tomorrow. So we may have some other information to share, but at this point, we don't need boosters from the data that we have available, and the CDC and FDA are not recommending that. So thanks for that question.
All right, thank you so much, Dr. Rabinowitz and the rest of our hub team. We are at the end, unfortunately, of our session. I know it's gone by incredibly quickly. We really value and appreciate all of the comments and questions here. And I want to point folks to the link in the chat where you can find a link to our box folder where recordings of today's session, along with resources shared, including today's slides, will be available for folks. I know that there was a comment in the Q&A that mentioned that the slides were hard to read, so those should be a lot more accessible for you there. Again, or I guess before I go ahead and jump off entirely, any final thoughts from our hub team?
Yeah, this is Joe. I just want to thank everyone for joining these echoes. I know many of you join every week, and we just really appreciate you all staying informed and asking us the questions that are on your minds. It helps us so much to know what questions you have. If there are other ways that we can express information that you think would be more clear, or maybe hit the target a little bit better, especially around vaccination, we want to hear from you, because we need to get our vaccination coverage rates up. That's the bottom line. We just don't have high enough coverage rates to stave off this Delta variant. So we need to do whatever we can to get more people vaccinated. So if you have creative ideas on how to do that, how to message it, please let us know. Also, last thing, if any of you have any signs or symptoms of COVID, please get tested and put yourselves in isolation until those test results get back. Okay, thanks everyone.
All right, thank you so much, Dr. McLaughlin. And just to point folks, if they do have feedback, is there a email address or contact information that's best used? Perhaps we could drop that in the chat before we conclude today.
Yeah, I think, Heidi, do you have thoughts on how best to do that?
I was going to say COVID questions at alaska.gov is a great way. We love receiving your questions. We have dedicated staff that triage those questions, and all of us take part in answering those questions. Absolutely.
All right, Heidi, perhaps you could type that into the chat. Thank you so much. All right, again, much appreciation and thanks for those folks attending today's Public Science Echo. And for joining in on this dialogue. It is really valuable. So our next session in this series will be next Wednesday, July 28th from 12 to 1 p.m. And just another reminder to visit that shared box folder to access videos and resources from all of our echoes in this project, including the links that are shared here in the chat today. All right, take care, everyone.
Thanks, everyone. Bye-bye now.